So the current model of primary care doesn't work very well. I think the experience of care is awful, to be quite honest. We wait too long, care is fragmented, the way we are treated by most primary care practices you would never tolerate in any other industry. I think the outcomes from primary care are actually poor in general. We do poorly in terms of control of diabetes and hypertension. And then primary care itself may not be expensive, but because of poor primary care, total health care is expensive. We're in the hospital, in the ER, and in the sort of cath lab and testing more often than we should. I think it's like a three-legged stool, and you've got to do all three. The temptation is to do one or two, but it doesn't work. It would fall over. The first is you have to change the business model of primary care, how we're paid. Right now we're paid per sick visit, and we believe that's the wrong way to pay for primary care. You just get more sick visits. Instead, what we do is we ask to get paid a fixed amount per patient to allow us to figure out how to take care of them the right way. The second piece of it is to change the delivery model completely by giving people health coaches, by being proactive and not just reactive, allowing people to interact with us not just in a visit, but by email and by video chat and by text message in groups, and then to be proactive with people as opposed to reactive. And the third piece of it is to have a different IT system. Right now, the electronic health records out there for primary care really are built around the billing and coding, which doesn't really improve care, as opposed to having an EHR, which actually helps you improve care with people. The core to our model, how we change delivery, is having these health coaches. These are people who typically may not even be from healthcare. They're like the patients we're serving from their communities and help them with the blocking and tackling of what it needs to be a patient, understanding your disease, knowing what to monitor, making a plan, and being held accountable. They work with the doctor in the practice and work face-to-face with patients as well as by telephone and email. They're a key part of helping people manage their health better. I think in general, practices today are pretty full and they're making money. And I think from their point of view, somehow, what's the problem you're trying to solve? I think what's going to make them change is people like us doing it better, getting patients to vote with their feet. That's what gets people to change. U.S. airline industry, circa 1980, what caused United, US Air, Delta to lower prices and improve service was not consultants or conferences. It was one thing alone, Southwest Airlines. Build a better model, get customers to vote with their feet. That gets the old guys to change.